You're listening to Care in Conversation, brought to you by Essex Partnership University NHS Foundation Trust. This episode includes discussions of postnatal depression, birth trauma, and difficult pregnancy experiences that some listeners may find distressing. Please take care while listening.
Welcome to EPUT's Care in Conversation podcast. I'm Stuart. I'm your host today. My role within EPUT is I'm the staff wellbeing lead, and I support with anything to do with staff wellbeing, equality and inclusion, retention and engagement. I'm really looking forward to this episode today. So we're marking Maternal Mental Health Week, and joined by a couple of colleagues from the Perinatal Mental Health Service. So really excited for our discussion today. And also hearing from people who've needed the service and their stories as well. Joined by Salena. So Salena, hello.
Hello, Stuart.
Nice to be here for this episode. And Salena, it'd be great just to hear from you about who you are and what your role is within EPUT.
Okay, so my name's Salena Holmes. I'm the service manager for the north side of the Essex-wide Perinatal Specialist Community Mental Health Team.
Lovely, awesome. And could you give us a bit of an overview as to what perinatal mental health is, and maybe a bit of detail as well around the service that you oversee?
Okay, so yes, in Essex, the Specialist Perinatal Community Mental Health Team started in about 2017. It was commissioned. We were very lucky as a whole Essex service to be successful in the Wave 1 money that was heavily influenced by NHS England. We know that across England that there is about 1 in 5 women that suffer with perinatal mental health conditions of any varying degree. So that can go from adjustment disorder right the way up to postpartum psychosis. So initially when the service started, we were commissioned to see 3% of the Essex birth rate, and at that year we tend to work on the ONS, which is the Office of National Statistics, 2016 numbers. So it was around 23,000 births in Essex. So we were seeing those women that had more of the high-end spectrum of severe and enduring mental illness. And then back in 2019, NHS England and the local at that time was CCG, or now we are the ICB, so the Integrated Care Board. They wanted us to see and increase our contact to about 10%. So we had to then relook at the model of service that we were providing, our interventions, our workforce. So in essence, we work with mums that are currently pregnant, or currently we work with women that can be up to 2 years postnatal. We also offer preconception counselling. So if a mum is on any sort of what we call psychotropic medication, so antidepressants, antipsychotics, we can offer a one-off appointment with our perinatal consultant, who can talk through family planning and really thinking ahead about medication and the choices, discussing the risks and the benefits regarding the medication and their perinatal journey. Yeah.
Wow.
And I think within perinatal mental health, it's very much that sometimes it's the stigma that goes along with mental health, and it's good to hear that people are talking about it. There's been a lot of work that's been done with the Mental Health Alliance in promoting the work, and also promoting that it's okay to speak out. A real advocate for is obviously our Princess of Wales, who does a lot of work with regards to maternal mental health as well, and her own journey as well, because the impact that maybe having hyperemesis has on you physically as you go through can obviously impact emotionally and mentally as well.
Yeah, no, thank you. And that awareness, I imagine, is so important as well. So having really high-profile campaigns makes such a difference.
Definitely.
How do families typically come into contact with the service? Are there many different routes that people will reach out, or is there just a single way?
So our majority of referrals that we receive in, we don't have a self-referral as in you do when you go to talking therapies, but where we receive most of our referrals from are GPs, midwives, health visitors, community mental health teams, social care. So there are a lot of avenues. It is through the professionals that are referred, that refer the clients into the service. Yeah.
Lovely, thank you. Yeah, so a lot of different job roles and professionals involved, which is really great to hear. It's really reassuring to hear just how much support is available for mums just going through pregnancy, and you even touched as well, Salena, on some of the preconception support as well, which I didn't realise was there. Is there any myths or misunderstandings you'd want to clear up with this opportunity around the service that's provided, or more broadly around perinatal mental health?
I think for me the most important thing is, if a mum is suffering, because we know that when we talk about perinatal mental health, we talk about a perinatal frame of mind. So we think about the mum's mental health, we think about the infant's mental health, and we think about the mother-infant relationship. So you're thinking about all three aspects within perinatal. And something that one of our consultants said, and I think it's really, really quite pertinent, is the way you feel colours the relationship that you have with your baby. And, don't ever feel afraid to speak out. Nobody is going to judge you. You're probably your own worst judge, because there's people out there, there's services out there like our service that are willing to help people that want to help people. So if you are feeling low, if you're really struggling, then please just reach out, because there will always be someone that will be there that will understand.
Thank you. Yeah, that's a really great way to describe, and it almost reduces that sense of stigma as well, which you mentioned earlier. So, lovely. Thank you so much, Salena. Really great to hear about all the good work being done.
Thank you.
Great. So I'm joined now by Alex, one of the psychologists working within the perinatal mental health team. Alex, thank you so much for being here today.
Yeah, no problem. Hi.
And it'd be great just to understand a little bit about your role, and also maybe something around the emotional and psychological experiences that parents might go through during pregnancy or after birth.
Yeah, of course. So I'm the principal psychologist for the north half of our service. So I'm the psychology lead for kind of one half of the team, and do clinical work, but also supervise a lot of the clinical work that our psychologists are doing. And I think it's got quite a lot of layers. Maybe your question about the common psychological and emotional experiences that families will go through, because I guess there's a layer that's about what all I'll say mothers, because that's who we see in our service, that all mothers will experience. That's around kind of significant physical and physiological change that comes with pregnancy, birth, and the postnatal period, kind of significant change in hormones and endocrinology. So they're navigating this really kind of physical experience. And then this really significant psychological change. So we talk a lot in perinatal services about this idea of what's called matrescence, so maternal identity development, and how you basically are birthing a baby, but also birthing an entirely new version of yourself. So you have a one-day-old baby, but you are also a one-day-old kind of parent, and how tricky that psychological development is. And that, those significant experiences are just for ordinary mothers who don't struggle particularly with their mental health. And then we've got another layer of mothers who might develop kind of new mental health difficulties through the perinatal period. So have experiences of kind of traumatic experiences in pregnancy, birth trauma, breastfeeding or feeding trauma, moms who develop significant amounts of anxiety around just what it means to be caring for this incredibly vulnerable kind of being. And we have brains that are evolutionarily derived. So we've got parts of our brain that are very old and that are really threat oriented. And what they do, all brains, when you have a baby, is they start to scan for threat. And so all families and all parents, mothers, fathers, whatever the shape of that family is, will start to have kind of some intrusive thoughts around what are the dangerous things that could happen to my baby? How do I need to protect my baby? And sometimes that might develop for some mothers into something kind of more significant, like a obsessive compulsive disorder presentation. And then we have the layer of moms who have existing mental health difficulties that might either be maintained or exacerbated through the perinatal period. So it's a lot to kind of manage just in and of yourself as a person in the context of, what we know about poor sleep, significant demand of looking after a baby, maybe also having to manage all the other kind of social stresses that exist. So it's a big old thing for families to be doing, and a big thing, that we ask of them to show up in the world and for their babies like this.
Oh, thank you, Alex. Yeah, and it's really interesting hearing you describe as well just the range of different ways that mums and parents as well, the experiences they go through. Because as you explained, there's those practical changes, social changes, but then there's also the mental health side as well, and that could be, pre-existing conditions, as you mentioned, or it could be something exacerbated through pregnancy. What, in your experience, how do people first make contact, or is there any pattern or common ways that first step seems to look?
Yeah, I mean, I think maybe an important thing to say is that it's a really hard first step to make, that people are often really anxious about asking for help, especially for help around things that look like mental health difficulties, and especially kind of new parents, because they have there's lots of stigma and lots of worries about what does this mean for my competence and my ability as a parent. What will services do? Will my baby be removed? Am I kind of able to do this? And so I think just the first thing to note is that can take a long time for families to ask for help. And that it is really a really brave thing to do, and always something that we would be recommending that families try to ask for, because we're really, us and all services are really just here to be helpful. That's the whole function of us. Often families will come to us either through conversations with midwifery, either in pregnancy or postnatally, or through conversations with their health visitor. Sometimes they might get flagged to us through their 6-week check at the GP. And those are kind of maybe the most common routes. Or if they've got pre-existing mental health difficulties, they might already be under a service that then can notice the more perinatal elements of the difficulties and send them through to us. And then what we hope to offer is, as a first step, just kind of assessment. So really just trying to think with families about what might be going on. And I think the fundamental part of assessment is really thinking, what is going on for you make complete sense? So we should be able to say in an assessment, of course you feel like this, of course this is the way it's showing up for you. And we can really see this golden thread of why, the shape of the difficulty makes complete sense, and then can think about the right avenues for support going forward.
Lovely. Thank you, Alex. And as you described with the assessment, and you also touched on stigma slightly as well, and that came up in the conversation with Salena, I imagine in your role as a psychologist that trust is a really important part, particularly when you get into meet a new patient who needs support. Is there any insights or experiences you could share around building trust and how important that is in the service you provide?
Yeah, I think you're absolutely right. I think it is essential, and it's not just essential in perinatal mental health. It's essential in all kind of therapeutic services. What the research continually tells us is that, in fact, you can do whatever therapeutic model you like. The thing that creates the most therapeutic change for people is the relationship, and that fit between kind of the person receiving the care and the person providing it. So I think that idea of building rapport building, trust building, offering a space that is kind of non-judgmental, kind, and where families can really feel understood and held in mind, is the first step of any kind of piece of work, and a really important part, I think, of perinatal mental health values, and how we like to approach all our contacts with families.
And we also asked Salena as well, so I'd like to ask you, if that's okay, Alex, same question, around myths and misconceptions around perinatal mental health services. So is there any myths or maybe untruths you'd like to kind of address whilst we've got the opportunity?
Yeah, sure. I mean, I'm sure Salena would have talked about this idea of, that asking for help makes you a bad parent, or that you kind of, if you're struggling, it means that you're not being a good parent. I think that that's a really important myth to bust, that actually asking for help and worrying about how you are as a parent is just a sign that you're an excellent parent, and that you're just acknowledging that you can't do it by yourself, which none of us can do. The difference between people who ask for help and people who don't need to is usually because they've got a support system that exists. So I think there's something about myths around help seeking and myths around what happens when people ask for help and how they might be received and thought about. And so I guess an opportunity, hopefully, to say that, whenever we get a referral in, our thought process is always just kind of how brave this person must be to ask for help, how committed they must be to their baby and their family, even if they don't feel like it, even if they're showing up with bonding difficulties or really struggling with the adjustment to parenthood, that we're really trying to hold that kindly and gently, and we'd encourage them to do that for themselves as well.
Yeah, it's a big first step to take, and quite a privileged position as well for any healthcare professional who is there ready to support someone that comes in. So it must be a really rewarding job.
Yeah, it is absolutely a huge privilege to be able to offer support to these families at such a kind of pivotal time in their lives, and it's transformational, the work that we're able to do and the kind of differences you can see from when someone comes in to when they leave. We really get to become a part of their families in a way that just feels really significant and so rewarding. Yeah.
Lovely. Thank you so much for sharing your experience, Alex.
So it started actually when I first became pregnant. It was my first appointment with the midwife who came round to do an assessment, I guess. And it was during that actually that it came to light about the specialist service, because I had no awareness of it. But during the first sort of appointment with the midwife, we were going through my history, and I just wanted the ground to open up and swallow me, because that's when we started revisiting like my mental health and issues around addiction. At this stage, I'd been in recovery for quite a long time, but I just thought that the judgment was going to come. But the midwife was really good, and she gave me choice, and she made me aware of a specialist team that I could go under and have a midwife from, which just meant if I had a relapse in my mental health or due to hormones being pregnant, anything could happen, and it would mean I'd have access to support sooner. I really didn't want to do it because I really wanted to move away from my past, but I really also wanted to do the best thing for my unborn baby, and I knew that there was a possibility things could change. So I thought at that time it was probably best to go under the specialist team for support throughout my pregnancy. There's that fear around people thinking you're not going to be capable as a parent, that judgment, who I am today, not being treated who I am in that moment, and just on my past when people don't know about my past. So a lot of fear. I had the most amazing pregnancy, like it couldn't have gone any better, and the support I received from the midwife from the specialist team was just amazing. She treated me as a human being, she didn't judge me on my past, and she just treated me on the needs that I had in the current moment, which luckily I didn't need any extra support. It was just precaution more than anything. The most scary part of the process of being under the specialist team was I would have to have I had to go for a psychiatrist appointment while I was pregnant, just to check everything was okay, and I was petrified. I had no idea what they were going to come out with. I'd been under psychiatrists many years previously, and they weren't great experiences. But I remember receiving the letter after my appointment with the psychiatrist to say, you're doing amazing, you don't need any more interventions, go and be a great mum and enjoy your family, basically. And I just wanted to cry that, they don't think I'm crazy, they don't, they're not going to take my son off me. And yeah, really positive experience, and the support I got was just brilliant. Yeah, really supportive, really person-centred. They really listened and heard what I had to say, and it just really showed me what compassionate care really was and is. And unfortunately that's not what I received during labour, but having that compassion prior to giving birth really did make me feel safe and confident in going into labour. My experience of labour wasn't as I experienced in the community beforehand. So basically, when I was in labour, it was almost like my past had entered the room before I'd got in there. The midwife that I had during labour wasn't from the specialist team, just to add, but she was judging me on my history. She was judging me because I was under the specialist team, and I was judged, I wasn't believed, I was blamed, and I was even drug tested and alcohol tested 12 hours into a 24-hour labour for absolutely no reason apart from stigma around a past that she knew nothing about. Following birth, I received sort of stigma on the ward as well. 5 days, me and my son had suspected sepsis, so we had to stay in. But I was just wrapped in blue curtains for 5 days with little support, no fresh. I wasn't allowed out, wasn't told about sterilising rooms, lots of negative experiences. So when I did make it home with my son, I had nowhere to go. I felt traumatised by the experiences. I didn't know. My son was a forceps delivery and he had the biggest mark on his face, and I felt like it was my fault because the midwife had told me that I would cause harm to my baby if I didn't do better. So I felt this guilt and shame around my son and how he was born, and I feel so ashamed to say it, but I even photoshopped his mark out of the pictures, not because I was ashamed of him, but because I thought what people would think of me and the guilt that I had for causing that. So there was just lots going on for me, but because I have history diagnosis, but I wasn't unwell, so I didn't need secondary mental health support. But I couldn't access IAP talking therapies at the time because of my diagnosis. So no one would support me. Luckily that's changed now. So that's where the specialist team were able to extend their support. So the midwife that I had prior to giving birth, she had gone to team meetings to try and access me support. And it was agreed that I could have ongoing support. So I had a lovely lady from the specialist team, and she would come round every week and we would talk about how I was feeling. She would meet my son, which, obviously I want to show off my son. And she supported me through just feelings and emotions from my experience. Since then, during my current full-time job, I've had the opportunities to actually write some anti-stigma training for the NHS. And I've managed to deliver it twice now. One to new mental health champions within the NHS, and the first time was here actually to new starters. And it was part of that training actually that we had someone from the specialist perinatal team on my anti-stigma training, who then went back, spoke to Salena and told her all about the training I delivered, and then we got connected, and now I'm an NHS ambassador with the specialist perinatal team, and that's how I've landed here today. I think the biggest difference was rebuilding my confidence in my ability of being a mum. Not because I didn't feel like I could be a good mum. I had an amazing bond with my son, but I think it's probably the trauma from the delivery and the pain, the mark on his face that I could see, and the guilt and the shame that I had. And even though I know in my heart it wasn't my fault, at that time, I truly believed that I'd caused this trauma to my son. So the specialist team were able to just support me through that, being able to talk to him about it, see things from a different point of view, allowing me to accept what had happened without beating myself up, I guess, and torturing myself over it, and being able to let go of that emotional turmoil I was in, and to use them as a sounding board, support. So definitely helped me be able to move forwards from that instead of holding on to it. I would definitely say please do reach out, please do access support. I know that there's going to be a fear of judgment or being misunderstood, but there are people out there who do want to support you. There are people that are compassionate and will treat you where you are today in life. It's really important to know that you're not alone, and ask questions if you're not sure. If something doesn't feel right, challenge it. you deserve to be treated with kindness and respect and compassion. And, you're not alone. Remember, you're not alone. Reach out.
Before we wrap up, Salena, I'd love to come back to you. We've just heard from someone with lived experience of using the service, and it would just be really great for your perspective on why it's important that we hear from our patients.
So for me, it's most important to really get the voice of the woman with lived experience. These services have been designed for women, and we want women to use them and to benefit for themselves and for their little infants and for their family as well, because you can't just nurse somebody individually. We've got to think family, and that's the most important part.
Yeah, and that really speaks to what you said earlier around the multidisciplinary approach that's taken and the range of services too. And yeah, I think you mentioned earlier around if we're too prescriptive in the approach taken, that actually it could. Well, it's better to take a more holistic view.
Yes, definitely.
And what would you say to someone who's feeling nervous about reaching out, or maybe is on the fence or apprehensive? Stigma has come up quite a few times in our conversation, so maybe that's a factor. But yeah, what would you say to someone who may feel nervous?
I think the most important thing is to really think about being kind to yourself. And if you're really struggling and you can't be kind to yourself, imagine that you're speaking to yourself but speaking to somebody else, and giving them wise words that you would give to somebody else, give it to yourself. Because I think it's really important to actually just have hope, because sometimes that's the biggest thing. Stigma, and not just being in a place that you just can't see what can actually benefit from engaging, maybe because of previous experiences, maybe because of fear, but just reach out and just actually talk to somebody about it and take the advice and take the step, because the amount of women that have responded back to us and said being under the team has really changed my life. And I think that's really inspiring words that come from people that have been through the journey, so always do be kind to yourself and just reach out.
Thank you. And one of the words you said was hope, and I think sometimes we don't think of that enough when we think of challenges we may be going through. And I imagine you and a lot of your team have seen really amazing examples of people's lives that have completely turned around through the work you've done.
Yeah And I think I was speaking to someone actually downstairs about actually the work that we do, and the reason why we have such a compassionate workforce is because we do help women that are at really difficult times in their life, but that we walk alongside them and we're able to help them have that recovery. And that to us is the most important thing, to see people come through that journey and at a really special time in their life, and who are feeling really vulnerable, and they've allowed us into their life to be able to help them, to help themselves.
Amazing. Thank you so much, Salena. Is there any final messages for parents, partners or families just before we close this episode?
I think for me, it's very much about think family. It's about all our dads that are out there as well. Although we are a service just for, we work with mums, we do have what we call the other half hub. And I think it's really important that dads, you do have time for you, because sometimes you are the supporting person in your wife's journey, your partner's journey. But it's so important that you look after yourself as well, and that your needs are addressed.
Lovely. Thank you. So thank you, Salena, Alex, and our anonymous contributor for sharing their time, expertise and experiences. If you'd like to learn more about EPUT's Perinatal Mental Health Service, you can visit our website or speak to a healthcare professional. If you're listening and finding things difficult, please know you're not alone and support is available. So finally, thanks for joining us on this episode of Care in Conversation. We'll be back soon with more stories and insights from across EPUT.